my name is Reagan Swank, and today my proposal is to increase nutrition and health education for elementary students. Kansas has the 7th highest obesity rate in America. The State of Obesity, Better Policies for a Healthier America by the nonprofit Trust for America's Health and Robert Wood Johnson Foundation, said that Kansas has an adult obesity rate of 34.2% in America. That's up from 31.4% in 2014 when Kansas ranked 13 and 13.5% in 1995. The point I'm trying to make here is that obesity rates continue to increase, and there's a big correlation between children and adult obesity rates. According to the Kansas Health Institute, more than 29 million children live in food deserts, where access to fresh produce and other healthy foods is limited, and more than 15 million children live in food insecure households with not enough to eat and limited access to foods. According to the article by the Center for Disease Control and Prevention, 13.1% of children are overweight and 12.4% are obese. So this is the adolescent overweight and obesity increasing, and that's why it's very important that we need to increase our education. According to the Center for Disease Risk Control Prevention, only 27.8% of children are physically active for a total of at least 60 minutes per day on the 7 days prior to the survey conducted by the State of Kansas Nutrition. There is also a record of the inactivity of children. 14.4% of children did not participate in at least 60 minutes of physical activity on any day during the 7 days prior to the survey conducted. Today I'm going to address the State of Kansas Board of Education. I believe that the state of Kansas is failing the youth in helping educate children about nutritional and physical education. Many students in Kansas live in a food insecure area and are also not provided the necessary educational resources in order to live a healthier life. I have addressed this to the State Board of Education in Kansas in order to address this concern in hopes that they will make a change in policies in public education regarding nutritional education and physical education. My claim is to have the Kansas State Board of Education increase nutritional and physical education awareness in schools across Kansas. The state does not require elementary schools to provide daily recess, and it does not require a minimum weekly activity amount of physical activity or education for elementary, middle school, or junior high, or high school students. Physical activity time is covered in school wellness policy model guidelines. Classroom physical activity breaks are not required. The state does not prohibit the use of withholding physical activity, including recess, as punishment for disciplinary reasons, nor does it prohibit using physical activity as punishment for inappropriate behavior. According to Stanford Healthcare, encouraging physical activity is very beneficial. Children should have an hour of moderate physical activity most days of the week. More than an hour of activity may promote weight loss and subsequent maintenance. So, physical activity should be made required by the state of Kansas. Some children do not have the resources necessary to exercise at home or the opportunity to. Children who do not engage in any vigorous physical activity had at least 32% higher odds of being obese or overweight than those who exercised 5 or more days per week. Children in neighborhoods with no access to sidewalks or walking paths have 24% higher odds of obesity, and children who do not have access to parks or playgrounds had 20% higher odds of being overweight than their counterparts with access to such amenities. According to the World Health Organization, in a study done in Finland, if physical activity was more prevalent in schools or daycare centers, this could help reduce obesity in adolescents as such as half as the current child obesity rate. This would take the 12.4% obesity rate and drop it to 6.2% child obesity rate, while improving the amount of children who are overweight in Kansas. According to the shape of the nation, the state requires schools or school districts to provide their local wellness policy to the state education agency and to post it online for the public. The state monitors the implementation of local school wellness policies. So my claim number 2 is that nutrition or health class should be made mandatory for elementary and middle school or junior high school students. Kansas is lacking in wellness education. Kansas is the 6th worst state of healthy school measures. According to Dr. Nancy Breener and a study conducted statewide, Kansas lacks in offering students a wellness environment. According to a study done by the Department of Pediatrics, increasing education on overweight adolescents improved impact on participants' BMI and their attitude towards dieting. This study was done on 8th grade students and results showed a decrease in the participants' BMI. The key major aspects for a successful obesity prevention program was individual motivation, good attitude, and weight reduction, and peer influence. If students were taught about how to diet well and get in a more positive mindset for their peers, there is a good chance that obesity will decrease significantly. Not many adolescents know how to diet, nor do they want to, and strictly take after their parents when it comes to dieting. However, if education were increased to help all students understand what dieting is and how to properly manage a diet, their mindsets could change. Not only will this help teach students how to eat healthier themselves, this will help adolescents be more encouraging to their peers. Finally, my last claim is that the Kansas School Board should send an information packet about access to healthy and affordable foods in the area for parents. Now, while I'm struggling to find research about how effective this would be, there's a lot of research about the influence that parents have on children's health and wellness all around. There's a lot of research done on many children in less affluent areas who do not have access to as many benefits as other children do. While I believe this is extremely important and highly influential of obesity, the target of my presentation is to improve obesity in children. This is the most creative solution that I could come up with. Parent recognition and concern about their child weight status and other factors may influence a child's weight status. Interestingly, there is a lack of concordance between the actual weight status of child and parent perceptions of the child's weight. It is well documented that many parents do not recognize that their child is overweight. Additionally, a recent study found that many parents of overweight or obese children did not recognize that their child's weight posed a health risk, even among parents who accurately perceived that their child was overweight. Increasing parental education about nutritional and dietary needs for their children will not only help improve childhood obesity rates, but also encourages parents and children to be in a healthier mindset. Parents are not aware of the medical effects caused by obesity, and they should be made aware of this. Also, improving parents' knowledge about different resources available for access to healthier foods would be extremely beneficial to parenting and helping their child's education. On the information packet that would be sent home, there would be a list of tips for parents to help improve their child's health and wellness. Some of the tips would include gradually work to change some of the family eating habits, change the habits and the weight will take care of itself. Be a role model, encourage physical activity, and many more. Lastly, the pamphlet would include risks associated with childhood obesity. This way parents know why it is important to monitor their kids' health. In conclusion, I believe that the Kansas State Board of Education should increase nutritional and physical education awareness in schools across Kansas. They should do this by making physical education mandatory in public schools, requiring physical and nutritional education at elementary, middle school, or junior high, and high school, and by providing a pamphlet for parents to educate them. Thanks for listening, and I hope that you agree. Here is my bibliography.